Hi, I'm Brandi Kirk from Kirk Center for Healthy Living, and today I want to share with you some 4 core theories and exercises from Brain Gym, which is created by Dr. Paul Dennison. If you want to study a little bit more about Brain Gym, you can go to braingym.org. The reason why I want to share this with you is these 4 things I'm going to share. You can do them really fast, really quick. And they'll be great for stimulating the brain. The other thing that they'll do is, let's say you're on the computer 4, 5, 6 hours, these days 10 hours or whatever, and then you want to stop that activity and go take care of the kids or get on the phone with somebody. These will help you switch activities in your brain, and so it'll be easier for you to transition from one activity to another. We have also found that if we can adapt some of these Brain Gym exercises and do things just a smidge differently, they do affect the nervous system and calm it down. So those of you that are experiencing pain, this is just another way to try to decrease the pain, maybe turn the volume down on the pain. Might not take it all away, but if we can bring you from an 8 out of 10 pain down to maybe a 3 or 4 out of 10 pain, that's pretty good. So you have to kind of figure out what techniques work for you for decreasing pain. So this is just another one that we like to do. So in Brain Gym, they talk about these 4 kind of core exercises or theories that they like. The first one is just water. So drink a lot of water and stay hydrated. And if you stay hydrated, you can think better. It's just that simple. And so, especially in today, we might not be drinking so much as we should be. So just drink a lot of water and stay hydrated with that. If you're thirsty, you're beyond dehydrated. You should just never be thirsty. So that's the first concept, drink your water. And so the second concept is this thing called a cross crawl. And so I like to do this. Those of you that I've treated, you'll know that after I do a treatment with you, maybe some visceral manipulation of the liver or the uterus or the prostate or whatever, when we're done, I tell you to stand back up, and before I even put my hand on your head, I'll ask you to do this cross crawl activity. And the reason why I have you do this is it helps integrate the treatment that we just did. And so why would you want to do it at home? You want to do it at home because it's going to stimulate the spine, and right now we are sitting way too much, and so we want to be able to get some movement in the spine, and it also will help stimulate both sides of the brain. So the way that cross crawl works is you want to take your right arm and touch your left leg in any way possible. Like if you can't come up this far, that's fine, and then when you're done with that, you would just reverse, left arm to right leg, back and forth, okay? The only difference here is you don't want to do this. I've seen people kind of just like half do it, like they're about asleep. That doesn't help. So we want to get a lot of rotation in the spine and kind of stimulate that spine. There's some reflexes back there that are going to be beneficial and healthy for your spine. So just back and forth, whatever speed you want to go to, however high you want to bring up your legs, just make sure you're getting a rotation through your back. You don't have to do very many. All of these kind of theories and exercises, maybe 15 seconds a piece, not a big deal. Okay, so you can probably fit them in. So that's cross crawl. So we're drinking a lot of water, we're staying hydrated. We're going to do this cross crawl to kind of stimulate the spine. And then the next one that we're going to do is called brain buttons. Brain buttons is you take your thumb and probably your middle finger. You can use your index finger if you want, or your middle finger, whichever one fits and is comfortable. You're going to take them and go underneath your collarbones, okay? So your clavicles, the bones that stick out up here. You're going to put them underneath there, and then you're going to slide your thumb and fingers towards each other until you hit the sides of the sternum. The sternum is the breastplate here. It's the bone straight down the center. So if you go right underneath the collarbone and you just kind of bring it in towards midline, just a smidge, you'll feel there's like a little divot you'll go into before you hit bone again. When you're in that divot, there's a couple things with this divot. One is this is an acupuncture site for the kidneys. So anybody that has any kidney issues, This is a great place to kind of stimulate that acupuncture site, and sometimes acupuncturists will actually use this site for their needles as well. You're going to use your other hand and put it right on the belly button, just right over top of the belly button. Now, there's a couple ways to do this. Through Brain Gym, they talk about stimulating these points up here and actually rubbing your thumb and your fingers into that little space. It's kind of painful. It's a little tender. Most of you will have some tender spots here. This feels like it's stimulating my system, right? It's kind of waking me up. So if you're having pain, this may not be what you want to do. So if you're having pain, we're going to adapt this a little bit. You're going to keep the same position, so over the belly button and underneath the collarbone here with your thumb and your finger, and you're just going to lie down, okay? So we're just going to lie down. And then in this position, so my thumb and my middle finger are underneath my collarbone. They're kind of close to midline, close to the sternum. My left hand is over the belly button. And now, what I'm looking at from basically what we teach in the Braille Institute with the nerves, I'm looking at underneath the collarbone. This is where the phrenic nerve comes out. That phrenic nerve, it originates in your neck, and then it's going to come down right in the area that your thumb and your finger's at. It's going to travel all the way down into your abdomen, down into your belly here. And it's going to innervate or kind of provide messages to the parietal peritoneum, which is that big balloon that we talked about a lot in treatments. So that big balloon that holds most of your organs, not all of them, but most of them, and there's some fluid in there to help their organs slide and glide and move. So a lot of times with surgeries and things of that nature, that balloon, that parietal peritoneum can get irritated, and this nerve can really get irritated. So this is a great way to calm it down, is you just relax. I'm not digging in up here, I'm not rubbing, I just literally have my thumb and fingers just resting, and then my left hand's over my belly button. Why is that important? Well, there's some plexuses down here, and plexuses is just a fancy name for like a grouping of nerves. Think of it as like a bunch of little spider webs together, okay? So it's just a gathering of a bunch of nerves. It's kind of like a little network. And so if we can calm that area down, it'll hopefully decrease your pain, okay? You can stay here as long as you want. Obviously, if you're trying to decrease your pain and relax, 15 to 30 seconds might not be enough for that. You're going to want to probably do this a little bit longer. You could even add some of those breathing exercises that we've given you before into this routine. Okay, so I could do the breathing right now while I'm in this. Okay, so that's brain buttons. Now, the last one that I'm going to show you is called hookups. Okay, it's called hookups. So what you want to do is you want to take one arm, one hand, okay, and you're going to cross it. So you're going to cross your, let's say your right wrist over your left wrist. Okay, so just cross them. Okay, and then turn your thumbs down towards your body and grasp your hands, just like that. Now once this happens, you're going to bring your hands up towards your head. Okay, so let me show you that again. So you're going to take your right arm and cross it over the left, right at the wrist. Okay, so I'm just crossing it over. And then my thumbs kind of turn down towards the body, so my palms of my hands are facing each other. And I'm going to interlace my fingers. And I'm just going to bring my hands up towards my head, like so. Okay. Now, once I'm here, you just cross one leg over another. Okay. Since I crossed my right arm over my left arm, I'm going to cross my right leg over my left leg. Okay. So just make sure whichever arm you crossed over, you cross that leg over. Right. So right now I just crossed my right leg over my left leg. Now, in this position, again, I can do some breathing exercises. I can relax. Those of you that have kids at home right now that are going crazy, going absolutely stir crazy, if you get them in this position, it will calm them down. So this has kind of been proven to calm the nervous system down,
They've used it on kids that are autistic. They've used it on kids that have some ADD. And so research has proven this has calmed the nervous system down. So if your kid is like out of control, see if you can make a game of this somehow and get them in this position. It kind of reminds me of when you swaddle a baby, right? That whole act of swaddling. There's a specific way to wrap a baby that I think this mimics. Okay, so this is affecting your nervous system. It's calming it down. You can stay here as long as you want. You're not going to hurt yourself. You can do some breathing. You can do meditation. You can do whatever you want here. But when you're done, you're going to uncross your legs and you're going to bring your arms down. And when you get to here, you're going to just unlatch. And then here's the last part, guys. Your palms are going to face each other, and thumbs and fingers are going to be against each other. Okay, just like that. I'm just mirroring. Okay, so thumbs and fingers are against each other. And then I'm going to put my hands right over my belly button like that. Okay, so the base of my palm, my hands, my fingers are pointing straight up to the ceiling. And I'm just going to breathe into this. So my fingertips and my thumb tips are touching. Okay, your palms don't have to be touching. Okay? They're going to be on the skin above your belly button. You're just going to do some nice breathing here. And you're going to relax into this. If you're a meditator, you can do some meditation. And this is just a really great way to recenter and, again, to calm some of those plexuses down, calm your nervous system down. So hopefully this helps with some self-help techniques at home. Hope you guys are staying safe and healthy. And if you have any questions, please email me or your therapist, and we'll be able to answer any questions you have.